And we are live. All right. Hey, everybody. Welcome to Ask Our Vet, brought to you by Rockwell Pets Pro. Each week, we will be discussing the hottest topics in veterinary medicine and oftentimes the grossest topics in veterinary medicine. I'm your host, Mike the Voice Monkey, a full-time professional voice talent and 26-year veteran of the veterinary industry. And as always, I'm joined by Dr. Max, a 2018 graduate from Tufts Cummings School of Veterinary Medicine and full-time veterinarian at the Village Veterinarian in New York since the summer of 2020. What is going on, Dr. Max?
Oh, nothing much. Just a busy day in the office today, but happy to be coming live to our audience right now. Brutally cold day here in New York, but all our cat and dog patients showed up, and it was a nice busy day.
Very cool. Very cool. How cold is it up there in New York right now?
I think it's in the mid to high 20s. Yeah, it was not what I'm used to growing up in New Orleans, but you get used to it eventually. And everyone here is bundled up in their goose down coats, and all of my patients pretty much come with at least 2 layers of coat and harness, and all of these crazy brands. They're all dressed up and have their booties on, so protected from the rock salt and all that stuff that they're putting out on the pavement. But yeah, it's cold. How is it in Atlanta?
It's warm today. It was 60 something today, but it's going to get cold here in the next down in the 40s. So that's cold enough for me. I don't like it to get too cold. I am from here, so I don't want it. Cold is no good for me. Do you find you've gotten used to it living up north as long as you have?
As long as I have layers, and I feel like I have poor circulation in my hands and feet. So as long as I have adequate socks and gloves, I'll handle it.
It's too cold. So I did want to mention, I did see something this week that I've never seen before.
I did too. I guess we'll get to it. Please,
I'll go for it. I drove by. There's a veterinarian near me that's on the corner. It's high visibility. I drove by it, and there was a client outside walking their dog. It was a Rottweiler with a little curly Q tail that had long, it almost looked like a Pekingese tail. And I've never seen a Rottweiler with a little curly Q, curled up, husky, style tail with little stringy hair coming off of it. And I'm wondering where in that dog's line that tail came from. It's certainly not a Rottweiler. It was skinny and just, ugh.
Huh. How big would you say it was? It wasn't like skinny. Was it tall or heavy? Like typical size Roddy?
It was normal size Roddy. Yeah.
Huh.
Big old Roddy and just lumbering around with a little tail coming off the back. So I don't know. It was like, all right, fine, whatever. But
maybe some pug genes in its genetic makeup.
I know. Yeah. The mom got out one night and did some things she shouldn't have. So anyway, so what did you see this week that you've never seen before?
Yeah, this week, a little less well-known breed, I guess, than a Rottweiler would be Shar-Pei, which you're probably familiar with and seen a bunch of in your years in practice. Mm-hmm. I've seen plenty of Shar-Peis, but we studied a particular disease that they can get called familial amyloidosis or Shar-Pei fever, but I've never actually seen it. A patient of mine with it yet. Lo and behold, it was either Wednesday. No, it was Monday. On Monday, I saw a patient for the first time with that, and I was pretty excited by it. I mean, this poor girl. She's a 2-year-old spayed female Shar-Pei with really bad. I mean, they have plenty of roles, and they're a beautiful breed, but they do have fair share skin issues. But sometimes they can get really bad, genetic kidney issues, and it manifests itself in really high fever, she had a low grade fever, but really bad swelling of joints, in particular, like the hocks, the tarsus,
Okay.
like in the back leg,
Right.
and sloughing of skin and redness and just itchiness and not eating and some vomiting. And she wasn't doing good. But we got her on fluids, we got her on some supportive care and pain relief. And at least as of the next day, and the day after, she was doing better. I didn't speak to the owners today, but yeah, I mean, it can cause pretty bad flare-ups and really sky-high kidney values. But it was interesting to see, and yeah, it was that was my cool thing of the week, I guess. And I'm glad that at least for now, there's a happy ending.
That's one of the good things about you never know what's going to come in. In general practice, there was a lot of vaccines or, diarrhea, spoiler alert, or, things like that. But there always could be that one thing that comes in and everybody goes, oh, like, oh, everybody comes in and looks at it. What is it? What is it? And unfortunately, if you're a person going to the doctor, you don't want to be the person that all the other doctors come in and look at, because they've never seen whatever it is before. So you want to,
no, you really
you want to be
don't
the
want to be
routine.
Yeah.
You don't want to be the teaching case when it comes in. But I will have to say that Shar-Pei is one of the breeds I really hated to hold back in my tech days. They're always just to hug them up against you.
Mm-hmm.
They're very
you want to
greasy.
take a shower afterward, probably.
Yeah, especially if they've got skin problems, and like you said, a majority of them do. The puppies are cute. I mean, they're squishy and whatever, but then they grow up and they're
every puppy.
Yeah, they get hair in their teeth and it's just, they smell, and it's just one of those things to where you hold it up against you and you're like greasy, just nasty. But anything else?
It's a major responsibility as an owner, to ensure adequate hygiene and, coat care and all that.
Yeah, you can't look at the puppies and go, oh, they're so cute. They grow up, and do some research before you buy whatever breed it is, because every breed has its own little things that can go wrong or do go wrong. Or I'm famous at my old job is championing against like the doodles. I never liked the doodles, the golden doodles or the labradoodles. I know they're very popular. In my area, we have a ton of them, but they always had orthopedic problems. They had, they had the worst of the Goldens in terms of orthopedic issues, with elbow issues and hip issues and cruciate problems and things like that. So people always, oh, they're so hyperallergenic, but they weren't for me.
Yeah.
So what else is going on up in New York?
What else? Just that's about it. Today was a very diarrhea heavy day, so very apropos for our theme of the evening. Literally 3 dogs and 1 cat just back to back to back, for a variety of reasons. It's not a one size fits all approach, which I'm sure we'll touch on, and the plethora of reasons why a dog may have diarrhea. But I guess, just to be clear, if you're going to feed your dog, chicken one day, turkey the next day, rabbit the next day, which one of my owners, one of the clients was doing for her older puppy, that is definitely one of the ways that you could easily cause it.
Sure.
Maybe unintentionally. She's just trying to find the right diet, but
yeah. Well, I hope she's not trying to cause diarrhea. Yeah.
Hopefully not. But that would be one of the explanations. And then another one, has what I believe to be hemorrhagic gastroenteritis, which isn't necessarily, it's not the owners necessarily doing. No one really knows why HGE happens. And I'm sure there's, research being done on it now. But, the mainstay of treatment is IV fluids. And, that's what we got to do sometimes, be pretty aggressive with it. But yeah, so just kind of.
We will definitely get to all that In depth.
Yeah, we'll jump in the gun. But yeah, it was needless to say, there was a lot of rectal palpation happening today. We're going to send out some fecals. And yeah, that was a lot of smells in the office, but we deal with it. We have masks now. So honestly, it does make things a little easier outside of the OR and the treatment area.
Right. I can imagine. Yeah, certainly. And I wanted to let everybody know if they wanted to ask any questions tonight. If you registered on the Rockwell Pets Pro Ask Our Vet page, you can ask questions. They'll show up here on my screen. I will put them on our screen and we can certainly ask them. If you have questions about diarrhea, go ahead, shoot them on out. If you've got questions about anything else, any other vet, not anything else, not general trivia, but veterinary related, certainly give us the questions. We'll be happy to answer them. So go ahead.
You can try us in general trivia, but no guarantees there.
I'm very good at geography and science.
We're up for the challenge.
Yeah. We got nothing else to do. So what we're going to talk about tonight, would you say this is one of the more common, like maybe one of the most common things you see pets for?
Absolutely, without a doubt. GI upset, vomiting, diarrhea, and diarrhea. Those are the two, without a doubt, the two most common reasons why a pet will present to a hospital. Right.
So tonight we're going to be talking about diarrhea. Diarrhea is always funny because it's one of the harder words to spell. People spell it all kinds of different ways. And every time I applied for a job as a tech, one of the questions on the application was spell diarrhea. They always want to see if we could get it right. And I've never forgotten how to spell it. And Diarrhea is always like, there you go. Always has diarrhea. So the first question we have here, what is, well, it says dog diarrhea, but I guess cats can certainly have it too. So what is diarrhea?
Yeah, I mean, diarrhea is going to be something caused by some sort of malabsorption. So the nutrients that our dogs are putting into their bodies that we're feeding them, be it a therapeutic diet that you get because your dog is having really bad loose stool, or the fancy boutique grain-free, freeze-dried raw, non-GMO, whatever brand that you might not be able to get, but only at a very specific boutique pet store. They will have proteins, carbohydrates, fats, all the necessary nutrients that we need for life. Our gut is going to be processing that. Or a dog's gut will be, and digesting, emulsifying whatever the thing that's being broken down. But sometimes it isn't being broken down appropriately, and not to get too technical, but all the tiny little machinery in our small intestines or large intestine may not be getting those into our bodies appropriately, and it kind of comes out the other end mucousy. Sometimes there may be blood, and it could be frank red blood, or it could be kind of already clotted and more dark black in appearance
blood,
melena. And so that is kind of the stuff that you may be noticing with diarrhea, and it may be happening all at once. Maybe the frequency is happening, tiny amounts all over the place in your household, outside, wherever, or just kind of one of the words that comes up frequently would be voluminous, so large volume, projectile. Those are some adjectives that could kind of go along with it. But those are some of kind of the things that we're looking at with diarrhea in dogs.
That's just, my kids think it's hysterical that I'm coming up here into the studio and talking about diarrhea for an hour. They were like,
Yeah.
seriously? You're seriously going to talk about diarrhea? They think any potty humor is funny to them. So you say
I
diarrhea,
mean,
and they're hee 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 hee.
to be perfectly honest, like I can see being easily able to talk about diarrhea for an hour isn't enjoyable, not necessarily, especially maybe gastro. If I were a gastroenterologist, that's my profession, sure.
Right.
But watery stool, that's going to be caused by just so many potential differential diagnoses. Whereas past couple of weeks, we've been pretty parvovirus. So, that is the one thing that we're treating. Ringworm, that is the fungal infection. It's not aspergillosis or histoplasma or whatever it may be. Diarrhea, you could talk about that for days because there's just so many different reasons why it could occur. But hopefully we'll intersperse some.
Yeah, we'll get into that.
Yeah.
We only have an hour. We're not going to talk about this for days. So, but
hopefully not.
How serious is it in a dog's to have diarrhea?
It could be nothing. It could be change the food. It could be don't use this brand name food that costs $75 a bag that will last you a week, and instead just go to the store and go for a high quality food that you can discuss with your vet, but not necessarily one that's marketed or it's one of those things that I won't spend too long on this diatribe, but the pet food market is rife with a lot of good companies that do a lot of great research and development into their products, and a lot of those that are just trying to get a foot place in the market and find a clientele that I think it's all well-meaning, but sometimes they don't have enough time or clinical trials or feeding trials rather for pets to really back up the product, and it can be very expensive and not really lead to good results and poor body condition or skin issues, all sorts of things for dogs. So how serious it can be, it really ranges the spectrum based on the underlying cause.
So let's go with some of the causes. I know it could be anything. I mean, just like if we have diarrhea, it could be something we ate. It could be, you're sick, you have COVID, you have, whatever it is. That was one of the symptoms. But, with pets, we can't ask them, what's wrong? Is your tummy hurt? What's going on with your tummy? If you want to take a deep dive in it, man, just go for it.
Yeah, let's jump into it. But I just want to show
dog
the
comes
audience.
into your do what?
Yeah, this is just a funny little thing. I'm sitting here and I just look to my left and I see this glass of water that my wife was using this table earlier, doing some stuff online on the computer here, and there's a note for me. I missed it last week, but I think it might make you laugh. So this was from last week.
Ringworm, yeah.
It's a worm shaped as a ring. So, and then this was today's little thing.
It does look like that.
And she's encouraging me to drink water. So I have my glass of water right here.
Yeah, excellent.
But yeah, so jumping into the causes.
Yeah, you've got a dog that comes in your clinic. He's got watery stool. I mean, there's so many other things that he could be depressed. He could not be depressed. He could, be vomiting. He could not be vomiting. He could be super skinny and malnourished. He could be, pot belly puppy full of parasites. It could be, I mean, when you say diarrhea, you just go, oh, it's got loose stool. But there's just a whole rainbow. Maybe that's a bad word. There's a whole spectrum of diarrhea that it covers. So you have a dog come in with diarrhea. What do you do?
Well, the first thing that I do before I start recommending any diagnostics to the owner or treatments would be to ask them questions. And the main questions that I'll be asking them are, how frequently is this happening? So they'll know the normal for their dog. He always goes in the morning, or the morning walk, the evening walk, so twice a day. That's his normal, and he's been going, occasionally more often, or they'll be saying he's gone. Today, one of the historical notes that I got from the owner was that her dog had gone 20 times in the last 24 hours.
Perfectly normal, perfectly healthy.
Right. So that would be a marked increase, and that would kind of, in trying to localize the diarrhea. Know, where is it originating? Is it more small bowel, small intestine, or large intestine? So I'm thinking more large with that. I want to know, is the volume of the feces increased, decreased? I want to know if there's any mucus, if there's any blood. The color, and then getting to is it hematochezia, or like that really frank, blood versus melena, the darker one. If he's straining to defecate or shows any tenesmus, would be a big one. If there's any vomiting going on in conjunction with this, if the owner has noted any weight, like if it's a first-time patient and I don't have any previous records, or we can compare to the last time he or she was there. Is there a weight difference? And that is definitely something important to take note of. One of the dogs today was 54 pounds. I'm sorry, it was 54 pounds like 2 months ago when we last saw her. Today she was 48. So that's a significant body percentage of body weight that's lost there. Those are kind of the main questions that I'll be asking them. Depending on their answers, I'll be able to kind of think, where is this localized and what could be some of the causes. Other historical questions would be, have there been any diet changes? Have you, recent travel history, gone to the dog park? Some owners say that, Giardia has been going around Tompkins Square Park. And I believe it has, since I've seen some of the patients with it. And so, asking those questions is the first thing that I'll do. The next thing I'll do is, do you bring a stool sample? And
they never
some
do.
Owners are, they never do. A percentage do, but it would be more ideal if they did. But, always ask, and sometimes they do. And if not, sometimes we need to collect it ourselves. And if there's nothing that we're able to collect, doing a rectal exam, just complete liquid, there's nothing that we're able to, submit. Maybe we'll send them home with a prepaid fecal cup that they can bring us in at a later time. So those are, the big historical questions. And then, I use my exam findings if there's any pain and abdominal palpation. And, I check their mucous membranes, I check their hydration status, and all those things will kind of help me, if there's a fever, the list goes on and on. But those things will help me kind of start localizing where this diarrhea may be originating from. And then I may, in addition to the fecal, to rule out a parasitic cause, will potentially recommend blood work or a GI panel, depending on the history, if it's had, other baseline stuff taken care of already. And, I use my hands, my sight, my hearing, in the sculpting them. Sometimes there's, in speaking with my wife about cases that I see sometimes, I share words, medical words. And so borborygmus is a word that, we love to laugh at because it's just a funny word. And so sometimes borborygmi, or the gut noises are increased in these cases. And so that's what I can hear. And with my hands, could I feel a tumor? Could I feel, fluid in the abdomen? Or ascites, as it's known as. So all these things kind of come together and help me try to rule out, something as simple as stress colitis, which, dogs that are being boarded and there's no change in food. Their owners brought their diets and while they go on Christmas vacation or whatever, but there's hundreds of dogs in this kennel or something, which I know you can speak to that.
Yep.
And,
No fun.
they may have loose stool. So that's, relatively simple and not something that I'm too worried about. And, maybe some probiotics will help clear that up. Parasitism, for sure is one. So, the aforementioned Giardia, roundworms, hookworms, tapeworms, whipworms, Another reason why monthly preventatives, and I'll always ask owners, is your dog on heartworm prevention as well as flea and tick? Because that usually heartworm preventatives will control for those other intestinal parasites, which is nice.
Let's talk about those intestinal parasites for a second. When you get, I was going to ask you this earlier, when you get the fecal sample, when you get the stick and you lube it up and you shove it in there, what do you guys do with that fecal sample? How do you test for things with that? Or how do your techs do that? I don't think you do that.
Yeah.
When you pass it off.
Sure. It's, there's definitely, I'm not necessarily wanting to do that all the time, but, we always got to make sure to keep everyone happy. And I have no problem getting down and dirty as long as I'm gloved up. You use lube so as to not, make a traumatic like penetration, into the anus. And then, you can use a stick or, a finger, depending on size, not to be so graphic, I guess. But, the goal is to get that fecal sample. We, at my practice right now, we just send all of them out to the reference lab.
Really?
But in previous practices, they have the fecal floats, for the flotation, and then you kind of take a glass, or not a glass, like a plexiglass cover slip. Thank you.
Yeah.
It's been too long since I've done it. Take a look under the slide.
Yeah.
And 10x magnification, and you're looking for parasites or the ova, the eggs, and all of them have different shapes and sizes, and some of them have little operculi, but it's impossible to talk about it without actually looking at like a little chart that shows, this is an egg of an ascarid, toxicara, or this is a hookworm egg, and they have little differentiating features.
They all look different. Yeah,
they do. Yeah.
I've done. I don't know how many of those I've done in my lifetime. The little fecal floats. The doc comes out and hands you the poop covered stick. You have a little plastic tube, basically, and sat in a little bottom, and you put the fecal in there, and you had a little squirt bottle, and you squirt it in there, mix it up, and you put the little press. It's almost like a French press for coffee. So good luck drinking that again. We pushed that down there, filled it back up, put the cover slip on there. Wait 10 minutes, pull the cover slip off, and look in the microscope and see if you see any eggs. That was always one of my favorite things, because you kind of block out the world and you're looking in the microscope, and that's your little world on that slide. And it was always, granted, when a puppy came in, it was bloated in its belly, and it's full of roundworms and full of hookworms and every kind of worm, and you just look on the slide and go, yeah. And we had the chart on the wall next to the microscope that, point to the one it is. And where do they get these worms normally? Puppies just kind of have them, but
so it can be transmitted. Like in utero, often from mothers, but often, like if we're not talking about puppies necessarily, the fecal oral transmission is oftentimes how our dogs get this. So they smell some really what I'm sure smells good to them, feces outside, and they'll go for it and maybe smell it, maybe lick it, maybe eat some, and that's one of the interesting words, I guess, coprophagia that
Mm-hmm.
we learn about. Just and puppies often do it. Why do they eat their own feces? You put them in their cage, cage or crate for a little bit. You notice the feces, then you notice it's gone, and then oftentimes that's one of the big questions that I get from first-time puppy owners. Why is my dog doing this? And it's boredom is what we kind of attribute it to. Oftentimes, there's not enough toys around, enrichment, or they're they see a new thing and then they go for it.
They're very efficient.
So
They
very
didn't
efficient,
they didn't get all the nutrients the first time, so they have to do it.
yeah.
It's
The
like
second
rabbit.
pass, right?
Yeah. Yeah, the second pass at it, and they go, probably wasn't a good idea.
Yeah,
Oh, I've got worms now. So, how do you
yeah,
treat the worms when they come in?
yeah. I mean, it depends on the type, I guess. But you treat them usually with an oral, uh, pill or paste. That pyrantel. I think we talked about it at a
Strongyne.
previous.
Yeah.
Strongyne, exactly. Yep.
Mm.
The banana juice.
The banana milkshake.
Smoothie.
That's right.
Yeah.
So,
But yeah.
so I know it depends on the causes of the diarrhea, obviously, but how do you normally treat dogs that come in with diarrhea? Depending on the cause, obviously.
For sure. So I would say, if we're to break it down into the three, like the tripartite treatment breakdown, and sometimes it involves dipping into all three treatment modalities.
Mm-hmm.
I would say nutrition, correction of which includes water, which is the most important nutrient. So correcting dehydration, so the fluid losses. So
Mm-hmm.
we'll kind of group that into one category. So food, nutrition one, antibiotics in the second, and then immunosuppressive in the third. So food, metronidazole or Tylosin powder, or prednisolone. Those are kind of the three things that I think of, as to what diarrhea would be responsive to. And depending on the signalment of the patient, how old he or she is, underlying heart disease, what we think the underlying diagnosis is, would we dip into, one or multiple of those different things. But as you mentioned, it really depends on the underlying cause. And so blood work and imaging, and fecal and even urinalysis are important to kind of help us identify, getting closer to something that may cause. And then, what we haven't really touched on yet are the extra gastrointestinal causes, the things that aren't really related to the gastrointestinal tract itself.
Like what?
So, we're thinking about liver, cholangiohepatitis, liver tumor. 1 second. Talk to my mom later. Sorry about that. And endocrinopathies would be another one. So Addison's or hypoadrenocorticism. So talking about the adrenal glands, either they're making enough or not. They're not making enough, or they're making too much specific hormones. So Cushing's on one side versus Addison's on the other. Then you're talking about the pancreas and the important job that it has, in terms of regulating insulin in its endocrine portion, for that hormone, as well as the exocrine portion. So there's something called exocrine pancreatic insufficiency. And so if an owner reports really yellowy stool that's often chronic, I start thinking about EPI as a potential diagnosis. And then other things that we should also talk about, which we haven't yet, but of all the drugs out there that we use to treat various things, maybe not even related to say your dog has a pyoderma. We talked about hot spots in our second iteration of these talks. If you're giving a specific antibiotic for that, your dog might have blowout diarrhea the first time it gets a dose. A couple hours later, it is quite possible. We do recommend to give with food to reduce that risk, but an adverse drug response is no drug is benign, and even the drugs that we use to treat diarrhea or treat vomiting or whatever can actually end up causing worsening of that. So, drugs themselves are something to always, ask the owner the last time the patient has gotten something, even, the monthly preventatives.
Does it matter what color the diarrhea is? You mentioned yellowish diarrhea could be something with the pancreas. What if it's black or red or green, or I don't think I've ever seen blue diarrhea, but just to throw that in there.
I mean, it does. I think it matters less than I typically get like photos from the owners, emailing our practice email address, with 15 images. That might be a little bit overkill, but it is very useful to know, especially if an owner lets us know, Fido got into something that he shouldn't have, food off the table. I think it was last week that I was talking to an owner for a dog who had diarrhea, and I went through the laundry list of questions, and at first nothing was mentioned, and then at the end, after like I'd already asked about food or table food or whatever, she had mentioned that she noticed or the dog had eaten like a little piece of a clove of garlic or something. And I'm like, oh, well, that's very useful information. By the way, garlic and onions are toxic, so appreciate you bringing that to my attention now. But so like different foods can cause different colorations, and definitely like if there is blood, the texture and color of that is very useful for us as diagnosticians.
So if it's bright red blood, what would that point to?
I would expect that to be more so localized to like the colon.
And if it's dark digested black tarry stool.
So typically longer duration in the gastrointestinal tract before it arrives out into the environment, and so that would be more so small bowel diarrhea.
What about foreign bodies?
Yeah, I mean, we didn't even talk about that too. Typically for a foreign body obstruction, you'll also have other clinical signs. So, and I guess it really depends on chronicity. So, we spoke about small bowel versus large bowel diarrhea. We spoke about all these potential different causes. Then chronicity would be the other kind of breakdown point here, acute versus chronic, and when the owner first noticed these things. So one of my patients today has been having loose stool for 3 weeks. That's chronic. One of the other ones was, a recently adopted puppy. And it was, the owner not just got in, but essentially just did, and has been trying a couple of different diets, and it's been a couple of days, and that's more acute. And so that helps me kind of not rule out anything really, but just kind of gives me a clinical picture. But definitely, so, as you mentioned, foreign body, I would be expecting a lot of abdominal pain on palpation, vomiting, if it's something stuck wherever it may be in the GI tract, it's got to come out eventually. And if a dog stops eating or keeps eating, it can't get any further, it's going to come out the front end. So those would be things that I would be looking for as well.
Are there any home remedies that people could try if their dogs are having diarrhea at home? Can they give them? I have on my little list here. I have scrambled eggs, things like that. Is there any kind of food scrambled eggs? I'm interested to hear your thing. 'Cause to me, it just seems greasy and would just go right through. But would something like that be okay? What can people do at home to make sure they don't have to come in through the snow and see you guys?
I mean, sometimes it is necessary. So I would, teletriage would be very important, or is very important. But to kind of at-home remedies, if it's late at night or whatever, and whatever the case may be, I don't know, like in what case I would be speaking to an owner late at night. But if an owner, notices late at night and struggling what to do for his or her dog, there are systems in place to, reach out to the vet, 24/7 over like a telehealth platform. But generally speaking, what are some, good anti-diarrheal fixes, at least for short term? I honestly have not heard of scrambled eggs. I don't know, honestly, the efficacy that has, but in general, a bland diet, for which egg, is definitely a good source of protein and can be helpful. But I often, unless a dog otherwise, is told to me by an owner has a food allergy, chicken and beef are the most common ones. But unless otherwise, I do recommend, bland, a boiled chicken and rice, as a good option for a bland diet. And then, Pepto-Bismol is also something that owners often have at home and can actually be given to dogs.
If a dog is at home and is having diarrhea and somebody just doesn't want to come into the vet, they're just like, I don't want to pay to come in, or it'll be fine, it's just a little diarrhea. At what point should they say, you know what, I think we probably need to take him in? I mean, not that the dog's on death's door, but I mean, if it's, like, what are some of the signs that, like, okay, it's getting serious, you need to seek professional attention and not the scrambled egg?
It's a great question. And, it's funny because a lot of owners don't realize the severity sometimes. My dog's been having, explosive diarrhea for 3 weeks, and, we've been giving him, they think that the raw diet is going to be helpful for him when it's most likely the cause. Maybe a Clostridial infection or whatever could have happened, salmonella, I don't know. But, some owners disregard that, chronic diarrhea that's likely nutritional, probably food responsive if you change the food. And then others freak out at the tiniest thing. And, based on a history, I'm not so worried. No dehydration on exam. I'm not going to be recommending, too much initially, but owners want to, they've done research on Dr. Google. They want to rule out, they want to do a GI panel, look at the vitamin B12 and folic acid. They want to, which I don't initially jump for, that's not my first diagnostic, but they've done their research, for better, for worse. And you kind of try to, make, at the end of the day, do no harm. So like, I want to make sure that what I'm doing for my patients is what I think is best for them. And even if it's not necessarily a test that I would order, I try to do it in a piecewise fashion. And, why would I order an abdominal ultrasound if I don't do a fecal or like a, baseline, chemistry profile or something first? I really wouldn't do that. Some owners are adamant, and then eventually, you just got to explain to them, this is the way that we're going to go about with the diagnostic and treatment workup. And for the most part, people understand that. So it's a piecewise approach. And I guess, getting back to the initial question, what do I, or would I like tell an owner when's the right time to come? If your dog not only is having, this is just a generalized response, but in addition to the diarrhea that you're noticing, if you're also noticing vomiting on top of that, or, lethargy, not wanting to go out as frequently, inappetence, an additional clinical sign at home, that, or just like, he's not my dog anymore. He's like, something's off.
Right.
You as the pet owner may not be able to identify what it is, but there's some gut instinct. That
your dog better than
your dog
anybody.
better.
Right.
Exactly. Honestly, and I do tell my clients that frequently because, for some of my patients, I see them once a year on an annual exam,
Right.
and I may remember them because they're really, lovely pets, but I don't know them so well. You do, and if there's something that's off that gets you a little bit, shaking your head or whatever the case may be, for me, that's enough indication to recommend, bringing your dog to the vet.
So your dog's at home. Give us a couple of different ways you can test your dog's hydration levels at home. If you're worried your dog may be getting dehydrated from diarrhea, or your cat may be getting dehydrated, I know a couple. Let's see if you know a couple. Ha 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 ha. There you go, drinking water. So he's definitely not
Yeah,
dehydrated.
exactly. I know. I have double fisting. I got my
Oh
Nalgene
wow.
and my.
Oh, that's right. It's a different bottle.
It's true. It's true.
Hey, I drink
I'll
water
give
all the
you.
time. I got to stay hydrated for what I do, because if I don't, when I record, it's like smacky lips,
Yep.
and it's
Yep.
horrible. So yeah, stay
All right.
hydrated,
Well,
folks.
yeah. My recommendation for owners, very simple things to check at home, will be these are the two things: the skin tent. So kind of look at the neck, the base
Mm-hmm.
of the shoulder, between the shoulder blades, the scapula, and
Mm-hmm.
then usually your dog will have some skin back there that's loose. Kind of pull back on it, and a well hydrated dog, great skin turgor, it's going to go right back down, like
Mm-hmm.
instantaneously, and
Yep.
that is a good sign.
That works well in
Um,
cats too. Cats are,
yeah,
pull it
exactly.
up, and if it
Especially,
doesn't snap back, then yeah.
yeah. So you want it like a hat. You want the snapback hat. You want the snapback skin. You also want to check like the eyelids. If you have a sunken eyelid, and there's like a lot of space between the lid and the eyeball,
Okay.
that's probably a good sign, a bad sign of dehydration. And the other thing that I would say, depends on the dog, but a relatively easy check for a happy dog who otherwise would tolerate it at home would be to lift the lip, take a
Mm-hmm.
look at the gums, and press down on what's usually like nice and pink. Some dogs with a lot of black hyperpigmentation.
Right.
But if you have that capillary refill time, is what it's
Mm-hmm.
called, and if that epithelial surface, if it will blanch white essentially as you push down on those capillaries. As you release your finger, it should within 2 seconds go back to being nice and pink. If not, then we probably need to discuss volume deficits. So
Excellent. Yeah, that's exactly what I was thinking of. Also, if the gums are a little sticky, just if they've got
tacky.
just
Yep.
a dry mouth. So yeah. So
Yep.
I've got a question on here. It's funny. It says, can turkey give dogs diarrhea? I mean, if the dog goes to Istanbul and eats some of the food, I would think it would give him diarrhea. But oh wait, no. Oh, the bird. Sorry. If a dog
It's
eats
funny.
the bird turkey, can that give him diarrhea?
I just noticed that. That's very funny. Turkey and Armenia and Azerbaijan can cause canine diarrhea as well. So, yeah, I mean, yes, really anything can give your dog diarrhea. If your
Any
dog's
change in
on
diet. Yeah.
change in diet, yeah, especially if there's no gradual transition to it. If your dog's getting beef, that's what he or she's been on forever, and then you decide, oh, this is a cool label of a can you see in the store, or you accidentally get the same brand but the different protein source. You start giving that, all of a sudden it may accidentally cause diarrhea. Also, dogs may have allergy to it.
Yeah,
that
I
is
mean,
also a possibility.
it's the same with us. I mean, if you're a vegan and all you eat is vegan stuff, and then all of a sudden you go to one of those Brazilian steakhouses that you have the red and the green. You ever seen those? You ever seen those Brazilian steakhouses? Oh,
I've seen videos, commercials for them on TV. I've never been to one.
where you go and you sit and you've got a little dial, and one side's red, one side's green. And when it's green, they keep bringing you meat. They've got guys who walking around with meat on swords, and they cut it off and they put it on your plate. And as long as it's green, you got meat. And if if you're like, okay, I'm getting a little cute acidotic, then you flip it back over to red. Then they all disappear. They leave you alone. But as soon as you turn that thing over to green, meat on your plate. So if you're a vegan and all of a sudden you go to the meat place, your stomach is gonna go blah, and you're gonna have diarrhea. It's the same with your dog. I always wonder about my dog whenever he gets any kind of human food, because he eats kibble, and kibble can't taste like much. I mean, it's just kibble. But then I wonder if he gets that little piece of even bread or steak or something, like the flavor explosion that must go on in his in his head, because or her head, because it's just like, I eat kibble, then there's this thing, it tastes like something.
Right.
So yeah, any change in diet is going to upset their system.
That's true.
Especially little dogs. I think little dogs are affected worse than big. They get pancreatitis, and then they.
Yeah, we haven't really even touched on pancreatitis so much, but one of the dogs today, I believe, has that. There's just too many possible diagnoses, but that's kind of the fun of it. Trying to parse apart different things and hone in on a diagnosis.
Right. They've got on here, can overfeeding your dog cause diarrhea? Should you starve your dog if he has diarrhea? How can you prevent your dog from having diarrhea? I think we kind of went over that, where it's keep the diet copacetic and don't go crazy with it. But should you withhold food if your dog has diarrhea?
I don't know if there's a black or white answer to this, but it can be a very good. It oftentimes is a very good idea. Kind of rest the GI tract. I think there is a lot of research, and depending on what the underlying diagnosis is, if one has been established at that point in time, that smaller, more frequent, low-fat meals, say for pancreatitis or HGE, may be more beneficial than going NPO or not giving anything to a dog. And I've read different papers on this throughout vet school and stuff, and I don't know the right answer really, but I often, if a dog is willing to eat, I will not withhold. I will recommend, if they're in the hospital or whatever, small, multiple times a day, like GI low fat feedings. And that's usually what I recommend to owners at home. If they aren't able to do hospitalization, or kind of want to do outpatient, or can only do outpatient management, or whatever the case may be. That's generally what I trend to.
Okay, so before I get to our last question, which is not really a veterinary question, but if people watching, if you want to go to rockwellpetspro.com and use the code diarrhea, DIARRHEA, for natural probiotics for dogs. You get 10% off there at rockwellpetspro.com. So use the
Do you
code
have to
word
spell it
diarrhea.
correctly?
I believe you do. That's why I spelled it out.
Okay.
Diarrhea. It's a wonderful word. One of the questions we have here is it's not really necessarily a veterinary question. It's more of your personal opinion. If you're out walking your dog, and this would, I guess, apply to you pretty well in New York, and your dog has diarrhea all over the place. As a responsible dog owner, it says on here, how do you clean up after your dog if your dog just blows out on the sidewalk or on your neighbor's driveway or on your neighbor's porch? It's not really a
I don't
veterinary
know.
question, but it's on the little list here, and it kind of struck me as funny. And if you have a hose with you, you're probably okay. But
Yeah, it might be
you
more
just
of an
run.
ethics question. Might be more of a ethics class. Yeah, I guess it's probably happened to all of us at some point in life.
Sure.
I do find myself dodging visible feces on the streets of New York more so than in New Orleans and in Boston, and I live a year in Ann Arbor as well. But it's difficult. Like, unless you have water to splash down, I don't know exactly what you do about that. And if there's a drain nearby, try to get some water and hose it that way. But yeah, I don't know. I'm not exactly sure. But definitely the best thing to do if there's any discrete piles that you can take care of. They're responsible, for public health and the health of the dogs in the neighborhood.
Right.
Disposing of it, and that would be the way to go.
If you've got one of those orange traffic cones, put that on top of the cover it up. So crime tape. I'm sure there's some crime tape around somewhere in New York you could probably steal and just cordon off the area there to keep other dogs away.
Right.
So, all right. Well, it looks like we've spent an hour talking about diarrhea. I didn't know if we could do it.
We did it, I guess. Yeah.
We flew through it. And there's still, I'm sure there's still stuff on the table. So, yeah, I guess we are done for this week. I don't know what our topic is next week. We have not figured it out, but hopefully it won't be as gross as hot spots or ringworm or diarrhea or anything like that. So maybe it'll be vomiting. Who knows? It'll be some horrible thing.
Whatever it is, I look forward to discussing with you.
That sounds great. So we will see you guys.
Maybe we'll get some geography questions, or
I know.
Who knows what we'll get next time.
Yeah, absolutely. So once again, go to rockwellpetspro.com and use the code word diarrhea for 10% off natural probiotics for dogs. Want to thank you, Dr. Max. It's been a great show this week. We're going to wrap it up, and we will be back next Thursday, 7 p.m. Eastern on all these Facebook and YouTube channels. So thank you, Dr. Max. Have a great week.
Thanks, Mike. Take care. See you later.